Omni Eye Services is a multi-specialty referral practice that is philosophically aligned with the prospect of supporting the community optometrists who we work together with. We're multidisciplinary, having both optometrists and subspecialty trained ophthalmologists who work here to support the community optometrists and provide professional services. Optometric referral centers were started in the mid-1980s to address the relatively poor relationship between ophthalmologists and optometrists. Since community optometrists were forced to refer to general ophthalmologists in the community, who were also their competitors, oftentimes optometrists were treated poorly. Patients were stolen, patients weren't returned, the care provided by the community optometrist was denigrated, and so optometrists generally lost in the referral relationship. Optometric referral centers were created with the basic premise that a referral center practice could be supportive of the practice of the community optometrist. And so we agreed not to provide any competing services, so we provide no primary care services that would compete with our referring doctors. Our referring doctors are then assured that if they refer a patient here, the patient will receive high quality care and the patient will be returned for their ongoing primary care to their referring optometrist. So it's kind of a win-win situation. The referring optometrist is respected. We support the practice of the referring optometrist. We provide excellent patient care for those services that are outside of the scope of the referring doctor, and then we make sure that patients go back to the referring doctor for their ongoing primary care. A real win-win situation. Personally, I was always interested in the medical aspect of providing care to patients within optometry, and this was an opportunity for me to both provide the specialty services of medical care as well as provide important services to the community optometrists with our non-competitive supportive model of multidisciplinary care. So we support the optometrists that we work with, and that's very, very rewarding for me. Well, there are a lot of advantages to patients to this model of care. First of all, the surgeons who work in our practice surgery. They are able to perform a high volume of surgical procedures, which keep their surgical skills sharp. Secondarily, all the ophthalmologists in this practice have received subspecialty training. So they have experience within the specialties of ophthalmology, including retina, cataract, glaucoma, pediatrics, cornea, and refractive care. So they have a higher level of training than the general ophthalmologist. And that's great for patients because they have access to all of those subspecialties under one roof. There's also a great advantage for continuity of care, so that if a patient has, for example, cataracts and glaucoma, they can receive the subspecialty care from both of those specialties under one roof. And that allows for good continuity of care and good communication between providers. Communication is also key for our referring doctors. We make sure that they are part of the care process within all of these subspecialties by communicating carefully with them about all the services that their patients are receiving. Practicing in a referral center does require a certain desire to restrict the practice more towards the medically necessary services. So it's not like a traditional practice, perhaps limiting, but also very rewarding. Working in a multidisciplinary setting allows you to continuously learn from the other specialists within the practice, as well as to maintain a good working relationship with the referring doctors. So while we don't practice primary care here, working with hundreds of community-based optometrists keeps us well connected with the experiences of the referring doctors in the community. Multidisciplinary practice certainly has advantages because a team approach with cooperative care can benefit the patients. So we are very supportive of optometrists working collaboratively and successfully with optometrists. The model that is sometimes troublesome, however, is optometrists who are simply employees of ophthalmologists. If there's no mutual respect between the professions, then an employed optometrist who's employed by an ophthalmologist can potentially lose their their ability to make independent clinical decisions about the care of their patient. In a model where there's mutual respect between the professions, where both professions recognize that one is not dominant over the other, but that they're complementary professions, it can be very rewarding, and the team-based approach to care is one that could be very beneficial both to a newly graduating optometrist and to a surgical-based practice. Well, we think that the co-management model will be key to the future of healthcare delivery because it is a cost-effective model. We have providers working both at their highest level of expertise. There's good cooperation and collaboration and communication, which are going to be key to driving efficient care and ultimately to be having more cost-effective care. So when providers are each individually working at their highest level of training, then efficiency is at its maximum. And we really see, I think, ultimately what will be an important driver of cost, which is essentially what the nation needs and what our healthcare reform system is looking for. How do we drive efficiency? How do we improve quality? And how do we control costs? Clearly, this is a successful model. We support the community optometrists that we work for, and we provide great care for their patients, and we support their practice. Our motto is really that we're working both for their individual practice and our profession, because the more successful the profession is and the more successful the individual practices we work with are, then the more successful we will be. So it's a great model. It's one in which optometry plays the central defining role, and it works well for both the referring doctors as well as the surgeons and the providers here in the practice.